This video is for educational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. Always consult your healthcare provider with any questions or concerns about your pregnancy, health, or medical condition. Hi, my name is Jane Meyer, and I am a health educator at HealthNet. This video is about caring for yourself after birth, so you feel more comfortable coming home with your newborn. It's the transition from pregnancy to postpartum for you and from womb to world for your baby. In this video, we will talk about physical changes after birth, how to take care of yourself, healthy lifestyle tips, and emotional changes you may experience. Your body will go through a lot of changes after your baby is born. While many of these changes are normal, it's important to know when to get help. Call 911 if you have pain in your chest, shortness of breath or difficulty breathing, seizures, thoughts of hurting yourself or someone else, seeing or hearing things that are not there. Call your provider if you have a sudden swelling in your face, hands, or feet, an incision that isn't healing, either from a C-section or stitches at the opening of your vagina, a red or swollen leg that is painful or feels warm to touch, a fever of 100.4 or higher, a headache that does not get better even after taking medicine, or a bad headache with changes in your vision, heavy vaginal bleeding that soaks through one or more pads in an hour, or passing blood clots larger than an egg. Let's talk about some of the physical changes you may notice after giving birth. The first change is your uterus. During pregnancy, your uterus grows to 11 times its size. So naturally, it's going to take a few weeks to return to its pre-pregnancy size, which is about the size of a lemon. Afterbirth pains are belly cramps you feel as your uterus shrinks. You may notice this more during breastfeeding. They go away at the end of the first week postpartum. You can use ibuprofen, which is Advil, acetaminophen, which is Tylenol. Take a warm bath or use a warm pack to help with discomfort. Keeping your bladder empty can also help. Call your provider if you have strong abdominal pain or cramping. The second change is vaginal discharge. You can expect to have a bloody discharge called lochia. This is not a period. It's your uterus getting rid of the lining it used during your pregnancy. The first 1 to 3 days, you may notice a bright red color, heavy to medium flow, and you may have small clots. For 3 to 10 days, you may notice a pink or brown tinged color, medium to light flow, very few small clots or none at all. For 10 to 14 days, normally longer, you may notice a yellow-white color, very light flow, no clots, or a bright red color. Use pads, not tampons. Tampons can increase the risk of infection. Call your provider if you notice a foul-smelling odor. The third change is your stools and bladder. Your bowels may be a little sluggish after birth. Your first bowel movement can be a little uncomfortable. Be sure to drink plenty of water and include fiber in your diet. Walking can help. You may need a stool softener. Call your provider if you have constipation lasting longer than a few days. You may notice hemorrhoids. These are swollen veins at the opening of your rectum. They can be painful, itchy, and even bleed. Again, be sure to get plenty of water and include fiber in your diet. Avoid straining during a bowel movement and avoid standing or sitting for long periods. Use pre-moistened wipes like Tucks. You can also apply ice packs or soak in a warm tub. Call your provider if you have severe pain or bleeding. Your body is getting rid of extra fluid from your pregnancy, so you may have to pee more often or as often as you did at the end of your pregnancy. Call your provider if you have burning when you urinate with fever or very little urine output. And finally, changes in your breast. You may have tenderness, swelling, and changes in the size and shape of your breast. These changes are due to hormones and milk production if you are breastfeeding. Call your provider if you have a painful, firm, red area on your breast, nipples that are red, achy, itchy, or painful. You may have a yeast or bacterial infection, or flu-like symptoms like chills, body aches, including headaches. You could have a breast infection. Let's talk about how to take care of yourself during the postpartum period. Your perineum is the area between your vagina and rectum. During a vaginal birth, it stretches and may tear, so you may have stitches. Ice can help in the first 24 to 48 hours. On the next slide of this video is a resource to make your own soothing pads. Wash the area with mild soap and water at least once a day. Wash and wipe from front to back. After you go to the bathroom, rinse with lukewarm water in a peri bottle. You may have gotten one in the hospital, or I am showing one now on the screen. Also, change your pad each time. Try Kegel exercises. This is where you tighten your pelvic floor like you are going to stop the flow of urine or gas. Hold for a few seconds and release. Do this 2 to 3 times a day for 10 to 15 repetitions. This helps strengthen the muscles that were weakened during childbirth and improves bladder control. Rest and sleep. The balance of sleep and baby care is hard. You probably didn't sleep well towards the end of your pregnancy. Labor and birth is very tiring, and trying to figure out your newborn's needs can be challenging. Try to sleep when your baby sleeps. Take several short naps during the day. Don't use this time to get things done around the house. To help balance your routine, have simple meals with flexible meal times. Ask for help with shopping, cooking, and laundry. Try to avoid caffeine and ask for what you need when you need it. You may experience hair loss. This is not unusual in the first 5 months. Your hair was in a resting phase during pregnancy. Don't worry, it will return to normal growth. Baths and showers. With a vaginal birth, you can shower the first day. Baths are okay after that. With a C-section, you can shower once your catheter and outer dressing have been removed. Tub baths are not recommended for several weeks, so your incision does not get infected. Your period. Your next cycle can occur 7 to 9 weeks after birth, maybe longer if you're breastfeeding. However, you can produce an egg before your first period. Be sure to talk to your partner and provider about birth control options that are best for you. Sex. No sex until your vaginal bleeding has completely stopped. This tells us that the place where the placenta was attached to the uterus has healed. Otherwise, there is a risk of infection. Be open with your partner about resuming sex. Tears and incisions can take a full 6 weeks to heal. You may experience some vaginal dryness and need some lubrication. Nutrition. It takes a while to lose weight. Don't be too hard on yourself and don't starve yourself. It's far more important to stay strong and healthy. Healthy choices include fruits, vegetables, whole grains, lean protein, and low-fat or fat-free milk or yogurt. Include a variety of protein foods like seafood, lean meats, and don't forget beans, peas, lentils, nuts, and eggs. Limit foods and drinks higher in added sugar, saturated fat, and sodium. Eat foods high in fiber like whole grain bread, raw vegetables, fruit, and beans. Drink plenty of fluids, especially water. Eat small snacks to keep your energy up, like nuts and cheese cubes. If you are breastfeeding, just like during pregnancy, avoid eating fish high in mercury. Exercise. Talk to your provider about when to start exercising and what activities are safe for you. Start slowly and don't push yourself. Walking is a great way to start. 20 to 30 minutes a day. Simple exercises to strengthen your back and stomach can be helpful too. You can pause the video now to scan the QR code and learn how to make a postpartum padsicle mentioned on the previous slide. Emotional highs and lows are normal even for partners. Be patient with yourself and reach out for support if you need it. 70 to 80% of new parents experience baby blues, lasting from a few days to a few weeks. It's related to changing hormones and a lack of sleep. This is normal. However, if it persists after 2 weeks, call your provider. Get as much sleep as you can, ask for help, take a walk, connect with other new parents, and share your thoughts and feelings with family and friends. About 1 in 7 new parents experience perinatal mood and anxiety disorders. These feelings last for a long time after giving birth and can make it hard for you to care for yourself and your baby. It is not your fault. If you have a history of depression or anxiety, you are at an increased risk for it. If you notice these signs, call your provider. Depressed most of the day, every day. Shame, guilt, or feeling like a failure. Panicked or scared a lot of the time. Severe mood swings. Little interest in things you normally like to do. Tired all of the time. Eating more or less. Gaining or losing weight. Trouble sleeping or sleeping too much. Trouble concentrating on making decisions. Call your provider. Don't be afraid to reach out. Many women experience this. Try counseling with a behavioral health provider. Join a support group. There is a resource on the next page for free virtual support groups. Talk to your provider to see if medicine would help. I hope this information is helpful for you. Don't forget to scan the QR code and learn about free virtual postpartum support groups. Please don't hesitate to contact your provider with any questions.